to have you here, but we have another friends. Praveen Kumar. Actually, time difference, maintaining time, situation.
Sir, I'm here. Praveen Kumar is here.
Oh, Praveen, can you open your video?
Yeah.
Urmila Ghosh is here, so I could see Urmila. But you know, Edwin, live charge, we can share. Praveen Kumar, how are you?
I'm fine, sir. How about you?
Yeah, fine. Thank you. Live share চাষে দিতে থাকো চলুক মানুষ যুক্ত হতে থাকুক
Habibur,
yes.
Can you please tell us when are we going to begin?
Within few minutes, might be maximum 5 minutes, we will be on. So we're just connecting people. They are joining. So just wait next 5 minutes. Dr.
Perfect.
Juan. Yeah.
Habibur?
Yes.
Can I be able to present PowerPoint presentation?
Yeah, of course. So,
Okay.
we can help you, or you can proceed.
Okay. I am authorized to use the share screen?
Yes.
Okay,
You are authorized,
great.
so you can.
Okay, thank you.
Would you love to try right now, just to have a rehearsal for a few minutes? Yes, please.
Yes.
Yes, it's
Habibur,
Can you
That's
see
good.
it?
Yeah, we can see.
Okay, great.
Right.
should I
Very
present the speakers or would you present the speakers, Habibur?
good. No, you will present, but I will just hand over the speakers and participant to you, then you will just conduct the session, and in the mid of the session or end of the session, I might have some comments, or I can
Perfect.
just...
As we spoke, then I could make at the end a little commentary about all the presentation and that would be my participation, right?
Yeah.
Habibur?
Yes?
That would be my participation, right?
Yeah. As a chair,
Presenting.
you will invite each speaker, and after their presentation, you might invite one of our co-chair is here. You might invite co-chair, but so far I know co-chair, Mr. Sujauddin, he is sick. He cannot, so far I know, cannot join. So we might have some comments, and then you can conclude the session, I think. If there is any comment from the participant, then they can ask anything.
Perfect. Then I present each speaker, then at the end of all the presentation, I would ask the presentators if they have any questions,
Correct.
any commentaries, and then I make my commentary at the end.
Right.
We would end at 1 hour and a half, right?
1 hour and a half, 90 minutes session today. So
Okay.
each presenter, as there are six speakers, so if all join, you can give them each 8 to 10 minutes, then might have some time for Q&A, then 5 to 10 minutes for your conclusion. That would be
Okay.
wonderful.
That depends on the who will be present and how long they would take.
Correct, correct.
There are 5 presenters, I mean.
Total 6 presentation.
Oh,
But-
there are 6. Vladi, ¿me escuchas?
And one thing, if Vladimiro or any other friend speaker has any problem to speak English, Juan, it's better after his or her presentation, you might translate it to English. That would be great, I think, Dr. Juan, right?
Vladi, ¿escuchaste
Sí.
esto?
Dr.
dijo?
Shakti,
¿No vas a
I
querer que
could
te
see you.
traduzca?
Welcome back.
Me va a traducir
Vas a-
después. Voy a decir 3 o 4 palabras, Mane, nada más me traducís y listo, dale.
Ok,
¿Te parece?
entonces no lo voy a hacer al mismo tiempo. Me das una frase y yo traduzco la frase.
Sí,
Renglón por
no,
Live
renglón.
legacy, live will chat. Okay. So, ladies and gentlemen, Dr. Juan, honorable session here today. Dr. Juan, can you hear me? Dr. Juan Manuel, can you hear me?
Loud and clear.
That's great. So, would like to on the session, dear guest speaker, honorable session chair, co-chair, discussant, and participant around the world. Today, on the first technical session of the 4th WSWD 2021 4th International Conference on Social Solidarity, Strengthening Social Solidarity, Community Resilience and Global Connectedness. In the session, the first day, first technical session, myself, social worker Habib Rahman, gladly inviting you today to join us. And we are very honored, organizing committee is very honored here to invite Honorable Session Chair on the theme mental stress recovery, importance of therapeutic accompaniment, Dr. John Manuel, Session Chair from Mexico, joining us, and total 6 speaker from Milka Rodriguez from Costa Rica, she'll join Professor Vladimiro from Argentina, Jessica Millet from Costa Rica, Ogba Equin Stephen from Nigeria, Dr. Praveen Kumar Kulkarni from India, and Otieno Edwin Jeremiah Wilkins Nates from Kenya. Hopefully they will join very soon. I welcome you all. You know, the session is powered by the session organized by CSWPD Foundation, that is Community Social Work Practice and Development Foundation, in association with the People's University of Bangladesh, Department of Sociology and Social Work as academic partner, media partner Jamuna Television, radio partner FM 904, and so many other partners from home and abroad. I welcome you all to watch this session, and I'm just handing over this session to Honorable Session Chair, Dr. John Manuel. John, this is your turn to carry on that session now. Thank you.
Well, first of all, let me thank everyone for being here, all the national associate, international associate for this very, very important conference, 4th International Conference, Strengthening Social Solidarity, Community Resilience, and Global Connectedness. As we speak, this is an example of this global connectedness and this new world that we are approaching now. Yes, I was not, I was off. It was, okay. Let me begin again. Thank you everyone for being here. We thank everyone for as participants and listeners of this very important conference. We have speakers from Costa Rica, from Cuba, from Argentina, and from India, from Nigeria. So we have a small window throughout the world to speak on this topic. Thank you all. And as we speak, I would like to invite, first of all, the participation of Yamilka from Cuba, who has sent us a videotape that we can read the translation. Thank you very much. Vladimiro, ¿quieres pasar el video, por favor?
Ahí vamos.
La novedad al incluir al acompañamiento terapéutico como dispositivo tiene mucho que ver con el acercamiento que el profesional de la salud mental en estos casos y otros sectores se ajusta y se contextualiza más a los sujetos. Tiene que ver más con la posibilidad de crear el nivel de sensibilidad que minimiza el deterioro a partir de las comorbilidades, aumentando también el compromiso a la protección de estos por parte de la familia. Sirve también como práctica sociocomunitaria con funciones rehabilitadoras eficientes, principalmente en el nivel de atención primaria, lo que ha traído como consecuencia que disminuya la hospitalización en el nivel secundario. Como les decía, la intersectorialidad ha coordinado un trabajo con algunos sectores, por ejemplo, con programas priorizados como la prevención a las adicciones y la prevención a las infecciones de transmisión sexuales, VIH-Sida y otras hepatitis virales desde sus grupos claves, creando entonces, en función de esto, un recurso terapéutico para el observatorio de esas manifestaciones, incluso con el género. Es decir, que pasa a ser un dispositivo que se incluye en los protocolos para los observatorios jurídicos y de calidad de vida en las Federaciones de Mujeres Cubanas, en otros ámbitos legales donde se trabaja la violencia de género, que hoy en Cuba es una premisa. Lo sublime entonces está en esta modalidad, es el mayor acercamiento de los especialistas a las personas y no a lo metodológico. Va más allá de un proceso superfluo o estático donde solamente las investigaciones generen o aporten algo que creen nuevas estrategias para la intervención. Aquí no solamente se proponen estrategias, sino que en el mismo proceso se van construyendo las soluciones. Por eso, mucha salud al acompañamiento terapéutico, mucho entusiasmo en Cuba por esta nueva formación y de ahí los vínculos con universidades importantes como la Universidad de Oriente, la Universidad de Ciencias Médicas de Santiago de Cuba y la Universidad de Ciencias Médicas de la ciudad de La Habana. Vínculos también con la Sociedad Cubana de Psicología, donde se crean expectativas para generar compromisos de trabajo donde se vayan ubicando espacios para la formación, la capacitación y el intercambio mutuo. Así que abierta Cuba totalmente para esta nueva posibilidad humana de hacer digna la condición de enfermo mental y por tanto además alzar con el corazón todo lo que proviene de la salud mental.
Thank you very much. This is a brief participation of our invited from Cuba. So she could not be present for technical reasons. She's Yamilka Rodriguez Ramirez. She's a companion therapeutic from the methodological therapeutic accompaniment methodological update from provincial mental state program in Santiago de Cuba. So as we speak, I would like to invite now Vladimir Alexis Chatoni, accompaniment, therapeutic companionship from La Plata. I have to correct the program because he's from La Plata, Argentina. And let me tell him that he is one of the best clinicians that I know. He's going to speak us about the therapeutic accompaniment or companionship. Te traduzco frases y traduzco, ¿no? I would translate Vladimiro.
Hello. Bueno, antes que nada, agradecerle a Habibur Rahman por la invitación.
First of all, I want to thank Habibur Rahman for the invitation.
Y por la excelente elaboración de este congreso.
And for the excellent elaboration of this Congress.
Y les deseo que tengan un buen desarrollo del mismo.
And I wish you that you have a great development of the Congress.
El acompañamiento terapéutico tuvo su nacimiento.
The therapeutic companionship has his origins.
En la Argentina, a finales de los años 60.
In Argentina at the end of the 60s.
Como respuesta a los modelos de desmanicomialización.
As a response to the models of manicomialization.
Y del tratamiento en las adicciones.
And for the treatment of addictions.
A partir de entonces, el desarrollo de la profesión.
From that moment, dime.
A partir de entonces, el desarrollo de la profesión ha tomado características.
From that moment, the development of the profession had taken characteristics
de trabajo en contextos de vulnerabilidad,
of a work in the context of vulnerability,
en cárceles,
in jails,
con poblaciones migrantes,
with migrating populations, people who migrate.
Cuestiones de género.
Yes. A matter of gender. Género y qué?
Y salud mental.
And mental health.
El trabajo de nuestra fundación, Atalic.
The work our foundation, Vladimir is president of a foundation who is called Atalic.
Ha sido llevar esta profesión.
The work of Atalic had been taking this profession
a lugares como África,
at places like Africa,
Asia y especialmente en Latinoamérica.
And especially in Latin America.
Esperemos que esta corta intervención
we hope that this short intervention
despierte en ustedes el interés
awaken you the interest
para comenzar a realizar este camino juntos,
to begin to walk this road together
en el acompañamiento terapéutico.
In the therapeutic accompaniment.
Muchas gracias.
Thank you very much. ¿Es todo, Vladi?
Sí, es todo.
Habla un poco más, ¿no? Tienes mucho tiempo.
¿Quieres que diga algo más? El acompañamiento terapéutico.
The therapeutic accompaniment.
En nuestro país.
In our country.
Tiene características de formación universitaria.
Has a characteristic of university formation.
Y estas características se han ido desarrollando a lo largo de toda Latinoamérica.
And this has been developing around Latin America.
Dado la efectividad demostrada.
Because of the demonstrated effectivity.
En el campo interdisciplinario.
in the interdisciplinary field
del tratamiento
of this treatment
de las características antes descritas.
of the characteristic before described before.
Nuestra fundación
Our foundation
posee representantes
have representatives
en México, Costa
in
Rica,
Mexico,
Cuba,
Costa Rica, Cuba,
Togo, en África,
Togo, in Africa,
India
India,
y esperemos que muy pronto en Bangladesh.
and maybe very soon in Bangladesh.
Para poder seguir desarrollando esta profesión
To be able to develop this profession
tan efectiva
so effective
en el campo de lo cotidiano.
in the field of quotidianity.
El acompañante terapéutico
The therapeutic companionship
se incorpora en el día a día
is incorporated on everyday life
de la persona
of the person,
y de ahí desarrolla estrategias necesarias
and from that moment it develops necessary strategies
para llevar a cabo
to make possible
un proceso de resocialización.
a process of resocialization.
Entonces, el acompañante terapéutico no trabaja
The
con la
therapeutic
patología,
companionship doesn't work with pathology, con la patología,
con la patología,
doesn't work
sino,
with pathology,
sino que trabaja con el individuo.
it works with the individual.
Un individuo que vive
People, somebody specifically who lives
sí, en un lugar determinado, con una
in a
familia
certain place
determinada
with a specific family
y en un país determinado.
in a specific country.
El acompañante terapéutico debe
The therapeutic companionship must
entender el contexto
understand the context,
psicosocial de la persona
biopsychosocial of the person
para comenzar a trabajar desde ahí.
to begin to work from there. Sorry, somebody has his microphone open. Can they close it, please? Because we are listening to
শ্রাবণ শুনছো? শ্রাবণ, yes, please. All other, just keep your microphone mute, please. Yes, please, Vladimiro, you can continue.
Thank you. Entonces, el acompañante terapéutico
the therapeutic companionship,
se forma
it had a formation, a preparation,
desde una mirada biopsicosocial.
from specific biopsychosocial site approach, we might say.
Espero entonces
I hope then
que esto sea de su interés
that this would be from your interest,
y podamos muy pronto
and we can very soon
realizar algún intercambio desde el
realize
acompañamiento
very soon
desde el
we
acompañamiento
could make
terapéutico.
possible an exchange of therapeutic accompaniment.
Muchas gracias.
Thank you very much.
Y ya está, Mario.
Listo, Vladi, gracias.
Muchas gracias, Juan.
Okay.
Sos un gran
Thank you
amigo.
very much, Vladimiro. He says I'm a good friend, and I am. So our next participant, hello. Thank you, Vladi. He is something very important in Argentina since a long time ago. Now we have the great pleasure to present another therapeutic accompaniment that he is now in the University of Costa Rica, making the first academic formation of the therapeutic accompaniment. He had many seminars. He's a clinician who also worked with psychosis since 20 years ago, and a great person, very brilliant person. Jessica, I would like you the microphone, and you can speak English, right?
Yes. Thank you very much, Manny. It's a pleasure to be here with you. Good night there, and good morning here. And thank you, Vladimiro and Avibur, for the invitation, and Mane for the presentation. Well, I would like to share with you a practice here in Costa Rica. We are beginning with the therapeutic accompaniment, and we started in the University of Costa Rica in the post-grade, post-degree of psychology. We started the formation of therapeutic accompaniment in 2020, in the middle of the pandemic that we are suffering still. And we started this therapeutic accompaniment, and it was very helpful for the Ministry of Health in Costa Rica, because we started also like a pilot project with people that contracts the COVID-19. But what I want to share with you here today is a practice in the university, in one of the subjects of therapeutic accompaniment. And I would like to share with you a presentation. I'm gonna do it very fast because I don't want to take many time from the other partners. I call my presentation the subjectivity and social bond. The practice in the university, it consists in two parts. One is a theoretical part, a theory, where we share the constructions of the link. Of the theory, it's about that, the construction of the link, the place of the transference. What we call transference is a psychoanalytic concept of the bonding between the patient and the therapeutic accompaniment. Also, we transmit the subjectivity as a place of the therapeutic accompaniment, models of disinstitutionalization. Here in Costa Rica, we have the policies, the health policies tends to the construction, or we are trying to build a resocialization with all the patients that are institutionalized, like in psychiatrists, or the people that is abusing of drugs, or the children that needs the alternative care of, and other populations that are very vulnerable. So we are trying to desinstitutionalize all these vulnerable population, or yes, patients in institutions. And we try to transmit the reinvention of the social bond. It's impossible for, I think it's my position, that is very difficult to resocialize in terms that you have to force a person to re-socialize or start again, like co-living with the society, in terms that he has a disability, he has a disability, and he has to reinvent it. I rather prefer to say reinvention of the social bonding. And then the other part of the formation in therapeutic accompaniment is the practices. And in this, the practice includes, it's very important because we have to include a supervisor, and there's a team and a group that you can, that you have to form. And we, in the supervisions, we have the first supervision was an individual supervision for each student. He will observe first his the everyday life of the person he will accompany, and he will start like making a bonding and linking with him or her. And then he comes or she comes to the first supervision, and we started and tried to place some objectives for the practice, because it was a very short practice. I will tell you that. And then it was a supervision, a group supervision with the classmates, and where they can all learn from each other's experience. That will last. We made 18 practices with a 12-hour practice. It was 2 hours every week with the person that they accompanied. We made it with migrants, with an ONG, an organization, non-profit organizations with migrants, and we made it also with the public educational ministry in Costa Rica. So we took the practices took place in schools and colleges. We work with human trafficking and diverse identity, and also with a very nice program that we have in Costa Rica called Fundamentos. It's like mental health funding mental health. It's the name of the foundation, that it prevents mental. It's a foundation about prevention in mental health. So I would like to focalize, or yes, to put all the importance of my speech in the schools in Costa Rica, here, especially with a practice with a transgender person. We made five practices, and we
Puedes
were
extender un
trying
poco
to.
más.
Okay.
Te puedes extender un poco más.
Okay. And we were trying to attend or to care the people, or to make an intervention with persons and students that had risk of a school dropout or school exclusion. Because of the abstentionism, we were trying to reduce abstentionism. The victims of bullying. We also work with students in condition of traffic, special a woman. We work with a woman, and also with migrants. Here in Costa Rica, as in every country, we have migrants. And we have especially migrants from Nicaragua, from our north border, and they come to Costa Rica because here they can find some work, and they get into our system that they share with us. They live with us, and they are very helpful also. So we work with them. We have a little discrimination also. So sometimes we have we were working with not with discrimination this time, because of the country belonging, but we work with the discrimination of the gender belongings here in Costa Rica in this practice. So the characteristic of these students were individuals who are in situation of vulnerability, not only emotional, but also of rupture of the social bonding. Here is a little graphic that I did. It explains also what Vladimiro was telling us, that the place of the therapeutic accompaniment, it's in between. It's like an in between the institution that has his own internal culture and his own politics and laws, that how to proceed in the classes and in the classrooms and with the schedules. And the therapeutic accompaniment gets a little bit into this internal culture. He has to know it. He has to respond and answer to the laws of the institution, and he has to make it valuable for the student also. but also he belongs from the outside. He's coming from the outside, so he has another vision about the institution and also about the person. He observes what are the needs of the individuals, and and he needs very much to preserve this external belonging, because if he will be all in the institution, he will not have the external view. So it's very important for him to make a resistance to the institution violence, for example, that sometimes it normalizes, like bullying, for example. So this external point of view, the therapeutic accompaniment can preserve it by his supervisions, his personal analysis, and also working out with a team. Sometimes he works with a psychiatrist, maybe if they give medication for the attentional deficit, for example. Also, he works with the psychology sometimes, or with the psychopedagogue, and they make a team. We try. The teamwork is another issue. It has maybe we can write another paper about the teamwork. It's another issue. The functions of the therapeutic accompaniment is to listen to the institution and its demand. It's to give place to legality as a regulator of the social bond. He listens to the subject or to the individual that accompanies, and he builds support networks also. From his foreigners, what I mean is this external place that he preserves, the therapeutic accompaniment can be treated insofar as it is a factor outside the context. Okay, so sometimes his presence can be a little bit intimidated to the institutions because he's all the time observing. He's not judging. It's very far away from that. He is observing, he's trying to understand the policies, he's trying to understand the individual, he's trying to understand the link between the institution and the individual that he is accompanying with. Okay, so sometimes this imaginary dimension takes place, and he can be a little persecutory, so we have to be very aware of that to manage and lead with all these issues that came out when you are working. And that's why it's very important. He will, in this practice, in schools, they build a therapeutic team with the counselor in the school, with the supervisor. In that case, it was myself. I was the professor of the formation of accompaniment. He made it was a she, the therapeutic accompaniment in this case with this transgender. He is a male transgender. Okay, he was 13 years old, and he was trying to make the transition. And this therapeutic accompaniment, my student, when she gets into the school, she observes that he was victim of discrimination, gender discrimination, from the director of the school, and he was trying to expel? No. He was trying to take him out of the school so that he will be outside. He didn't want him to be anymore in the school. So that's why we intervened with the therapeutic accompaniment, and the first thing that she did was to observe him, listen to him, and also she started detecting the people, the teachers that were trying to support him, and she built up a network. That was very, very important, because that allows her to build up for him a support. Okay. In this accompaniment, therapeutic accompaniment, you have also the framing, what we call the framing. It's of the things that, like the rules, the place, the time that you're going to be there, all that all the things are part of the frame. It's very important because it's something that you cannot alterate or change, because it's a permanent thing that supports the accompaniment, the therapeutic accompaniment.
5 minutos.
Okay. So this demand, it's offer this demand from the institution, and the demand, there are many demands going on in the practice. You have the demand of the institution, you have the demand of the individuals, and you have the demand of the network also. But you have to lead with all, you have to do with all this demanding from the institutions. But he offers an ethical position. He has to respond with an ethical position, and his ethics starts with the individuality and with and the therapeutic accompaniment. Is not someone that is going to save the person. It's not someone that is going to arrange all the problems, but is someone who is specialized in trying to listen and organize what is going on. Mm-hmm. For example, in this case with this transgender male, she tries to focus his interventions in talking with him during recess, during the guide lesson. Also, they here in Costa Rica will have this guide lesson, and she will go for 2 hours and talk to him and speak to him and try to understand what was his demands. And well, they do a lot of work and trying to make the general office of the public educational ministry, since we are an university, a public university, we started a link with the public educational system, and we intervened putting how to say like an order, a restricted order to this director, because the director of the school was the one in charge of making the discrimination and trying to take him out of the school. So he was stopped from that, and we started to reorganize the link at the school with his partners and also with his classmates, because there was some bullying also, and especially with the teacher, that he was the one that was trying to help him with the theory part, and he was very caring with him, and he was helpful. And also the therapeutic accompaniment listens that in his house, he also was victim of violence. So she made an order so that our institution, we have a public institution that takes care for children, and they separate him from his house because he demanded so. And so the institution intervenes and separate him from his family and take him to an institution where he can go outside and still go to school. And in that part, the therapeutic accompaniment programmed to be for 2 months. In this case, this lasts for 6 months, because we couldn't let him alone. He was in a very deep depression. So we find, the therapeutic accompaniment started to build up a teamwork with a psychologist, with the ministry of the educational ministry, with the ministry of the childhood also. So we started to build up like a bonding, a network of institutions, and also a network for him of persons, of teachers, of a person that he can admire also, and he can know that he has another opportunity in life, and not only to go to the streets as a transgender guy.
Tiempo.
Yeah, I'm finishing. So the goal of a therapeutic accompaniment is not to save anyone, otherwise we will be doing philanthropy. It is a bet for life. Sometimes the desire of the therapeutic accompaniment is not enough to get out of the social situations and the individual and subjective devastation. This does not stop us from continuing with the bet for a better life. Thank you very much.
Gracias, Jessica. Thank you very much, Jessica Millet from Costa Rica. Now we have the speaker. Yes, hello. Oh, yeah. We have the speaker, Agba Ikwen Stephen. She is an officer, Medical Social Welfare Services, Federal Neuropsychiatric Hospital, Calabar, Cross River State, Nigeria. The topic is social workers and indigent patients managed in government hospitals in Benin City in Nigeria. Welcome. Is she with us? Habibur, is she with us?
Wait.
Somebody open the microphone. I don't know if it's the speaker, but somebody has opened the microphone. Agba, are you here? Are you here with us? Habibur, if you know if she could be here. Yes, Habibur.
Mr. Habibur Rahman actually in another call, so he's busy now.
Oh, she's busy now. So we should continue now with Praveen excuse me for my pronunciation, please, but Praveen Kumar Kulkarni and Dr. Gangadhar B. Sonar, guest faculty, Department of Social Work and Associate Professor and Chairman, Department of Social Work, Karnataka State, Akamaldevi Women's University, Vijayapur, India. And the topic is Enhancing Self-Esteem and Substance Abuse Children, an Intervention Study.
Yeah, good evening all. I'm Praveen Kumar from Karnataka, India. And today I'm presenting a paper which is part of my PhD. And the title of the paper is Enhancing Self-Esteem Among Substance Abuse Children, an Intervention Study. This paper includes the following contents: introduction, a review of literature, aim of the study, objectives of the study, research and methodology, data analysis and interpretation, conclusion, suggestion, and references. As we all know, the period between 10 to 18 years is a transition from childhood to adolescence. This is the period where children are involved in execution of various marks of cognitive, emotional, and behavioral development. Also, it is called, this period is called as a transition from dependence to independence. This is a time of psychological, physical, and contextual changes in transition. It is also a period of increased risk taking. Substance use includes tobacco, alcohol and illicit drugs is one of the most concerning risk behavior. The rate of smoking in children has been growing over the last decade in some countries, including India also. So, keeping this few objectives, I have collected reviews from various part of which has the studies which has conducted in various part of India and in other countries also. So these studies are enlightened on the initiation of tobacco and how it impacts on self-esteem, and how self-esteem is going to protect children from substance abuse. Also, few studies has enlightened that how low self-esteem children are initiating substances, and how high self-esteem is going to protect these children from substance abuse. So the aim of this study is to assess the impact of intervention on improvement of self-esteem of substance abuse children. And the objectives are to investigate the various substances abused by the children in Vijaypur city, which is located in Karnataka and India, to assess the impact of intervention on improvement of self-esteem of substance abused children in Vijaypur city. The methodology of this study, we have undertaken the intervention research design by adopting single subject design with pre-test and post-test. In this nature of research, pre-test and post-test without control group design are followed. The unit of the study was a substance abuse children in the age group of 10 to 18 years, residing in Vijaypur city of Karnataka. With the help of snowball sampling, we have selected 67 children, and we collected the semi data with the help of semi-structured interview schedule. Also, we have assessed the level of substance use. We screened by using ASSIST, which is developed by WHO. It is called as alcohol, smoking, and substance involvement screening test. And also to assess the self-esteem level of substance abused children, we have been used a scale which is developed by Rosenberg called self-esteem scale. The collected data were edited, coded, keyed, and analyzed by using computer through the statistical package for social sciences. And we applied paired sample t-test to see the significance differences. And the majority of, when we go through with the results of the study, the majority of substance abuse children are Hindus, and followed by Muslims. Hindus, we met Hindu children up to 40.3%, and the Muslim children 38.8%. And majority of substance abuse children belongs to the other backward classes, that is 44.8%, and scheduled caste 40.3%. The significant percent of substance abuse children studied up to high school, that is 32.8%, and attained industrial training institute certificate. It is called as ITI in India, that is 19.4. Significant percent of the substance abuse children are not attending school and colleges. that is 47.8. It means many children are dropped out and they were working in building construction and in cleaning toilets, and they are working in dabas, in hotels, and in bar, in restaurants. And the majority, the significant to note that the pocket money given by parents without realizing the need may enable children to include in purchase of substances. And also, the majority of substance abuse children are belonging to nuclear families, that is 94%. When we have been used to screen the substance involvement, as I mentioned previously in methodology part, we have been used assist to screen the substance use. So here we can see tobaccos in the pre-intervention stage. The mean score of tobacco was 6, and in post-intervention it is decreased up to 4. And alcohol use at pre-intervention stage it was 3.39, and in post-intervention is decreased up to 1.37. And cannabis usage in a pre-intervention stage was 0.43, and which was decreased in a post-intervention up to 0.18. And inhalant use at the pre-intervention stage was 1.9 to 1.49, and which has decreased up to 0.45. And the other substances, we have collected local intoxicant items like Sindhi, which has prepared at the local level. The mean score was 1.87 at the pre-intervention stage, which has decreased in a post-intervention up to 0.60. The t-test has been applied to see the significant differences between mean score of the pre-intervention and post-intervention of substance abuse children. And we can see the mean scores which has reduced with the reference to practice of tobacco products, alcohol beverages, cannabis, inhalants, and other substances. Also, we can see the significance two-tailed paired t-test also confirms that there is a significant differences between substance abuse scores of few substances of children. Therefore, it can be stated that the intervention module has a positive impact on substance abuse children. Hence, the hypothesis is accepted. And also, to assess the self-esteem, we have been used Rosenberg self-esteem scale. An attempt has made to see the impact of intervention on self-esteem of substance abuse children. The mean score of self-esteem after intervention is increased when compared to pre-intervention mean score. The two-tailed t-test also signifies that there has been a positive impact on intervention of substance abuse children in enhancing the self-esteem. So the gap between pre-test data collection and post-test data collection was up to 5 months. When it comes to conclusion, the period of 10 to 18 years of children is a very important development stage of their life. They are faced with many problems like psychological development and untoward family circumstances such as poverty, illiteracy, quarreling, separation, divorce, step parents, and their social environment. They are also vulnerable from their peers, role models, and the media also. Many children are influenced by variety of substances which can endanger their own lives as well as the lives of their of the other people who are located in their family. According to the result, of a present study, since those with a history of substance abuse had lower self-esteem than normal people, the study found that there is a significant influence of substance abuse on children's self-esteem. It means substance abuse children's self-esteem level is low due to use of substances. So keeping that in mind, after collecting the pre-test data, we have been developed 12 sessions intervention module with the references of local experts and local key informants, and with the help of WHO modules, and with the help of UNICEF intervention modules, and the other studies which is conducted in India and in other countries also we referred. On the base of those studies, we developed a suitable intervention module, and we implemented. It is recommended that people of society in various ways try to strengthen and improve their self-esteem. The child development organization need to have prevention programs in order to target multiple settings and multiple risk factors, particularly vulnerable children such as children of substance users, children injecting substances, street children, and children involved in child labor, trafficked children, children of sex workers, and other categories most at risk. School must conduct life skill education, counseling programs, leadership skills, and personality development trainings to children, so that children can develop personality and will not turn towards substance abuse. Parents should engage in open communication with their children regarding their behavior. This will help the children to know where they stand with their parents regarding their behavior. This form of communication should be adopted equally by educators in schools, by other caregivers such as child and youth care workers, and social workers in institutions. Government should encourage non-government organizations, guidance and counselors and psychologists who are consultants by contributing their codes to society through establishment of centers which will help in educating gives orientation, educating and gives orientation to the society at large about the health risk involved substance abuse, and as well as damages it brings to the society, and also to help reducing substance abuse among undergraduates. And finally, we have been referred these articles and books. Thank you very much.
Thank you very much. Very interesting. Now I would like to Habibur to comment us. The microphone is open for somebody, but I would like to ask Habibur to comment something and to invite someone else.
All right, Professor Dr. John Manuel. As I could see, many friends are here, participants. So it's better, Dr. John, just to get some voices from our friends. As I could see, Zakir Hussain is here, Suhail Khan is here, Dr. Shakti is here. Actually, Dr. Shakti and me, we're just fighting since morning, having much talk. So Shakti, you have several talk tomorrow. May I ask Zakir Hussain to speak a few words for our Mexican and North American friends? Inspiring words from Dr. Zakir Hussain. Actually, they were wonderfully presenting papers. Mr. Zakir Hussain, Zakir Bhai, could you hear my voice? MD Zakir Hussain, could you hear me? Okay. Mr. Suhail Khan, could you hear me? Arshad can hear? All right. Mr.
I'm
Khairul
listening.
Islam, Honorable Principal from Natur. So, Mr. Khairul Islam, are you interested to speak a few words? Mr. Khairul Islam, Honorable Principal, Natur Polytechnic Institute. So, are you interested to speak a few words for the speaker? Honorable Principal, sir, from Natur. Yeah, I see, but your microphone is mute, so please unmute this. Oh, no headphones. So, all right, no worry. No. Can you speak here? Please unmute your phone. Okay. Yeah, it's on now. So, Honorable Principal, are you interested to speak a few words to inspire our foreign friends here in this platform? Again, it's mute. All right, no worry. Speak tomorrow. Let's come to Suhail Khan. Suhail bhai, Mr. Poet, actually my brother Suhail Khan is here. So, Suhail bhai, are you interested to say a few words for them? Speak loud. Actually, volume is very low sound. So, can any other hear him?
Nobody.
Nobody. Should we increase the volume of the device or headphone? It's not functioning. All right, leave it. We cannot hear you. So most probably you are hearing us, but we cannot, right? So actually this is the open forum, very nicely presented under the leadership of Professor Dr. John Manuel from Mexico. My friend Vladimiro wonderfully presented through Spanish language, though I couldn't understand, but Juan nicely actually retranslated it all. We're very happy, Vladimiro. And Jessica, wonderful presentation you did today. We're very honored, and on behalf of this team and organizing committee, myself, Habibur Rahman, really, we are very grateful to all of you. And Dr. Praveen Kumar, I was just following your presentation, throughout presentation. That was really amazing, and thoughtful provocation was there from all sides, and everybody did wonderful. Before coming to honorable sessions here, actually I was looking for someone who loves to comment on this. So Dr. Shukti, are you here? Punam Gulalia, are you here?
Yes, I am here, Habibur.
All right. So can I request you to say a few words for our speakers now?
Since the morning, we have been engaged with a range of people and their thoughts. So by the time we have come to the end of the day, I'm personally trying to grasp and trying not to miss out on new thoughts which are coming up. So it will take us, and many people are new on this platform. Like, we have not engaged with them professionally, but it is very, very heartening to see that how the speakers have shared their experiences with us.
Correct.
And are willing to be honest in that sharing. That is what struck me the most. That even when she said that teamwork, we'll talk about it another time, it requires some other time. I was thinking of my own teamwork processes at work. So it triggers a lot of thought, but I would at this moment just like to appreciate the speakers for sparing their time and be willing to spare and share their work with us. Thank you so much.
Very good, Dr. Punam Galali. Actually, we met today morning, 12 hours so far in the morning, and it's night. This is 9 p.m. evening here in Bangladesh, and the whole day we had the grand opening session. After that, we had two keynote speakers, and session chair of the keynote from Japan and keynotes from UK and Singapore. We had a nice plenary session inviting 5 scholars from different 5 countries in the afternoon. And this session, the first technical session, we have invited 7 speakers, though all cannot join, but from different countries. Actually, this international platform, Dr. Juan, before coming to you, just my few comments, I'm really impressed because this is that we do believe this is an international platform and people are coming throughout the world just to share and just to care through sharing of voice, knowledge, and experience that they gather in their specific field. That Jessica mentioned, that actually Vladimiro tried to focus on, and of course Praveen, me, and we all are trying to make a platform which we can share, in which we can share our thoughts and values and ethics, and of course working experience throughout the journey, having some grievance and sorrows in personal life. So I think this platform already, we just made it so far, inviting you, and we are very honored that it's not the small time, COVID. This time, after tomorrow, we might get already declared, but we'll get the notice, government gazette that whole country will be under lockdown for 7 days. And still we have promised to continue our efforts in academia, in livelihoods, in business, in other parts. So we are just trying to continue all these things. We are under threat, and life is really under threat. We are in a big challenge all the way. We are under stress, and irrespective of ages, we all are in tense situation and passing. Just when I was off for a few minutes, I got a message from one of my professors from Indiana University in USA. All are intense, but they love to be connected. That how can I contribute some thoughts and voice for the people around the world? Because in the morning I mentioned this is the platform where we can share, and we do believe sharing is the best caring process. If you love to care someone, definitely you have to create some space for share their mental grievance, just to relieve from the suffocation that's the whole world is passing through currently during this global pandemic. So we are very honored, Jessica and Vladimiro. I was really wondering how you could match the time. It's really tough to manage the time, really. We are very grateful to the participant and listener, because I do believe you all will so far more or less agree with me that listening is, it's very tough. Patience listening is, hearing is very tough. And the accompaniment with the professionals and the social worker that we always give faith on, to be a good worker, you have to be a good listener first. To be a good counselor, good accompaniment, good therapist, good doctor, good professional, you have to be a good listener and passionate listener first. That is the basic ethics and value of the, I think, in our profession. So I think all the participants here, they have that caliber and capacity to be the accompaniment, right, Vladimiro? And the best social worker ever, because they have that capacity and moral and mental strength to have this passions, passion hearing. This is very vital. So thank you again. From my side, I just like to hand over this mic to Dr. Joan Manuel, honorable session chair today. So Joan, this is for you for a few minutes just to wrap up the session, Joan. And after that, I just can say hello to everybody. After you. Joan, please.
Well, first of all, let me thank everybody, as I said before, for being here. And as you can see, we are connecting. If we can see the world's going back and forth from here all the way to, I think, India, all this continent. We covered the world, you see. and we can be close or we can be far away, and in this work that we have. And this is an example of what we do to exchange the word, to make the other one present, to make hope, to try to appear as someone different who would not betray us, who would not let us apart. For example, the excellent example that Jessica did. But I have many more from, for example, a microphone is open. I don't know, Abibur, if it's yours. So this is an example of our work. I mean, we can be closer. We can be together. And this is a message that we can transmit to any situation, to any people. What Vladimir had said is that what we essentially is that we had to go one by one, and we have to study all life. And it is very implicated our own way of listening, our own way of thinking the other as a person, not only as a professional. Sometimes we are not two things, we are one thing. And we have to take care of that. I mean, I am sure that this therapeutic companionship had begun the first time when somebody in a difficult situation treated with dignity the other. That is therapeutic also. And that is something that we cannot teach. It is something that we can only inspire. And it is in all the words that we have seen today. It is about love. It is not only a technical thing. It is one way of putting love into life in any situation, in the people who are in the abyss of society, in the without hope. So it is not only, especially for example in the school that Jessica said, it is not about being another professional that is about only pedagogical stuff. It is only to listen why this kid doesn't have the space to learn in his head. What is inside there? And so to listen, to be able to really listen helps everyone and make us go one by one. The first and most important way of reestablishing social bond is listening, and that is dignity, and that is also a way of putting love to work. So for my part, I saw all and I know Jessica and I know Vladimiro, and it's not that they know, they are people who, like a door, the door can open. This is my door. A door can open, no, to another space. We are something like this, that make the doors open, that make the words circulate as we are doing around the world. So I hope that whatever I told you can make you translate that into better questions, especially about the other and about love. And for my part, that is all. Thank you, Abibur. Thank you, everyone. And you can count on us. We can be companionship for you always, and you for us.
Thank you. Thank you, Dr. Juan, for your wonderful session sharing and valuable time, really. We are very grateful to Vladimiro, to Jessica, Dr. Praveen, Ogba, actually they cannot join, and all our friends participating and listening our voices here. Let me just share about our program schedule tomorrow. Tomorrow there is another second keynote session tomorrow, Bangladesh time 9:30 a.m. And already I send you all Professor Jessica from Dominican University. She will speak as keynote speaker, and Professor Ghulam Matpur will be chairing the session. Actually, that is our tomorrow's plan. Gradually, we will have most probably 4 or 5 sessions hold along. So you will be joining us, and at the same time, tomorrow just at 11 to 1 p.m., 2 hours. At the same time, there will be 2 sessions. So we already send you email having the program schedule. Just open your email and press on the link of Zoom. You can attend that you love to join, really. Thinking the theme and sub-theme and speaker of the session. So you could enjoy, we do believe. And I should definitely, in all the sessions that I did in the morning, I congratulate and convey my gratitude to all our actually loving partners, like organizer of the conference, that is CSWPD Foundation, that is Community Social Work Practice and Development Foundation, academic partner, Department of Sociology and Social Work. Actually, that I'm the chair of the department of the People's University of Bangladesh, International Associates, Daegu Association of Social Worker, Junming Happy Care, from South Korea, development professionals from West Bengal, India, and Vladimiro. Could you see your logo here? Huh? Could you see?
Vladimiro, ¿puedes ver el logo ahí?
Right, this is Vladimiro's.
Thank you, however.
All right, official logo is here of your company and organization. And among the national associates, we could see from the left, that is the red color logo, that is the narcotics departmental logo, Department of Narcotics Control, Government of People's Republic of Bangladesh under the Ministry of Home Affairs. Then the UDPS, the kind of development organizations, then Work for a Better Bangladesh Trust, Health 21, Institute of Wellbeing, International Lions Club of Uttara Professional, DBF, Debating Forum, Amra Shobai Foundation, Safe Home, Multi-Mood Commodities, Human Wellbeing Foundation, RDO, Mr. Zakir Hussain is here. He is Honorable Executive Director of RDO, Metropolitan School, Basli, that is in Bangladesh Association of Sign Language Interpreters, MUB 92, and our media partner was Jamuna Television. Already they focused this, on this news in excellent manner, and Radio 9904 FM. So this is a set, and you are the loving partners, all the guests here, all the participants here. Actually, you are boosting the session globally. We're very honored and grateful to all of you. So with the permission of Honorable Session Chair, Dr. John Manuel, and inviting all to watch all rest of the session up to 6th of April, till closing session on 6th of April at 8 p.m. to 9:30 p.m. Bangladesh time. Just mark it again, till 6th of April, Bangladesh time, 8 p.m. to 9:30 p.m. till closing session, watching the cultural ceremony even. It might be a very narrow shape, but there will be some poems, some our cultural part. We will just definitely thinking for that, just to warm you up. So till then, be with us. And from Bangladesh, good night, everybody. Good night. Have a safe stay at home. Good night.
Good night. Thanks very much.
See you again tomorrow.
Thank you very much. And I would just like to tell you that we would like to invite you to the next International Congress of Therapeutic Companionship, the 19th, 20, and 21 of May in Costa Rica.
Sure, of course.
Thank you very much.